If you are over 60, gathering your pills into a plain cardboard shoebox, just like this, is the single most important medical appointment you will have this year. I'm going to show you why 4 of the most harmless pills in your cabinet, including the one you might take to sleep tonight, are actually on a strict medical warning list. And more importantly, I'm going to show you exactly how to replace them. I'm Dr. Robert Harrison, and in my practice, I see this exact scenario play out every single week. People come in feeling exhausted, dizzy, or cognitively foggy, thinking it is just a normal part of getting older. But before we go any further, I need to be absolutely clear with you. Do not abruptly stop taking any prescribed medication without talking to your clinician first. This isn't about throwing your pill bottles in the trash in a panic. It is about becoming the proactive auditor of your own health. By the end of this video, you will know exactly which common, everyday pills are secretly putting enormous strain on your heart and your brain. And I'm going to give you a step-by-step communication script so you can work with your doctor to upgrade to modern, safer alternatives without any friction or argument. We call this the Polypharmacy Cascade. It happens when you treat one benign symptom, like a sore knee or a stuffy nose, with an outdated medication, and that pill accidentally triggers a severe secondary event, like a massive blood pressure spike or a major fall. Before we dive into the first medication category, I want you to take a look at your nightstand tonight. Do you rely on a PM pain reliever to help you fall asleep? Let me know with a simple yes or no down in the comments. Be honest, because you are definitely not alone. Let's start with category 1. This is the advice I give to my own parents and relatives when I look through their medicine cabinets. We are talking about chronic NSAIDs. I call this the blood pressure trap. So we are looking at ibuprofen, naproxen, and similar over-the-counter arthritis and pain relievers. Millions of seniors take these every single day for joint pain. You buy them at the grocery store, they sit right next to the vitamins, and they seem perfectly safe. But here is what the FDA black box warnings and the AGS Beers Criteria, the gold standard medical list of inappropriate medications for older adults, want you to know. Chronic unmonitored use of these pills is not just hard on your stomach, it is a direct assault on your cardiovascular system. Think of your heart as a pump and your blood vessels as a network of flexible pipes. As we age, those pipes naturally get a little stiffer. When you take oral NSAIDs consistently, they alter your kidney function, forcing your body to hold on to excess sodium and fluid. Suddenly, there is significantly more fluid packed inside those stiff pipes. What happens? The pressure skyrockets. Your heart has to pump twice as hard just to move the blood around. That is the cascade effect. You took a pill for a sore hip, and you ended up in the emergency room with a hypertensive crisis. Let me tell you about a patient I'll call Arthur. Arthur is a 68-year-old retired machinist from Chicago. He came into my clinic incredibly frustrated because his blood pressure had been stubbornly high for 6 months, no matter how carefully he ate or how often he walked. His previous doctor was just about to put him on a 3rd blood pressure medication. I asked him to do exactly what we are talking about today. Bring his shoebox of pills in. Right at the bottom, buried under his vitamins, was a giant, bulk-sized bottle of ibuprofen. He was taking it twice a day, every single day, for his bad knees. He didn't even consider it a medication to mention to his doctor because it didn't require a prescription. We stopped the oral NSAID. Instead, we swapped him to a localized, topical anti-inflammatory gel. This targets the knee directly without flooding his entire bloodstream and raising his vascular resistance. We combined that with basic acetaminophen for the background ache, and we incorporated some simple physical therapy and heating pads for his morning stiffness. Within 2 weeks, Arthur's blood pressure plummeted back into a beautiful, normal range. He didn't need a 3rd blood pressure pill. He just needed to stop accidentally fighting his own heart. That is the danger of chronic, unmonitored use of everyday pain relievers. But the next pill in your cabinet doesn't attack your heart. It goes straight for your brain. And it mimics one of the most terrifying diseases of aging so perfectly that seniors are misdiagnosed every single day. That brings us to category 2. This is the pill that goes straight for your brain, and it mimics one of the most terrifying diseases of aging so perfectly that seniors are misdiagnosed every single day. I call this the fake dementia trap, and it revolves around first-generation antihistamines. Most commonly, we are talking about diphenhydramine. You know this medication. It is the active ingredient in traditional allergy pills, but more importantly, it is the exact same ingredient used in almost every single over-the-counter PM, sleep aid, and nighttime cold medicine on the market. Millions of older adults take this every single night because it is cheap, it is readily available, and it makes you feel heavy and drowsy. But the AGS Beers Criteria is incredibly strict about this specific class of drugs for adults over 65, and the medical community has been sounding the alarm on this for years. Here is what is actually happening inside your head. Your brain relies on a crucial chemical messenger called acetylcholine. This chemical is essentially the lubricant for your memory, your focus, your learning, and your clear thinking. First-generation antihistamines are highly anticholinergic. That means they aggressively block this essential chemical messenger. If you give one of these pills to a 30-year-old, they might feel a little groggy the next morning. But when you give it to a 75-year-old whose brain chemistry is naturally producing less acetylcholine to begin with, the effect is profound. It doesn't just make you sleepy. It actively suppresses your cognitive function. It causes severe dry mouth, blurry vision, urinary retention, and intense daytime confusion. I once cared for a woman I'll call Denise, a 74-year-old from Austin. She was brought into my clinic by her daughter, who was in tears. Her daughter was terrified that Denise was showing early signs of Alzheimer's disease. Denise was forgetting recent conversations. She was getting deeply confused in the late afternoon, and she seemed to be living in a constant mental fog. I asked them to bring in all her medications to do a shoebox audit, and there it was. Denise had been struggling with mild insomnia, so she started taking 2 blue PM pain relief pills every night to knock herself out. She had been doing this for over a year. She was experiencing severe anticholinergic toxicity, and it was perfectly mimicking cognitive decline. Pause the video right now. Go check the back of your sleep aid or your nighttime pain reliever for the word diphenhydramine, ortomaconverts, or ivermectin, and drop a yes in the comments if you found it. We immediately started the collaborative pivot with Denise. We safely tapered her off the PM pills. Instead, we swapped her to a basic daytime pain reliever for her minor aches, and we introduced a few simple techniques from cognitive behavioral therapy for insomnia, things like strict sleep hygiene and keeping the bedroom temperature cooler. Within a week and a half, the dementia completely vanished. Her brain woke back up. Her daughter got her mother back simply by removing a pill they bought at the grocery store. If you are using these medications for seasonal allergies rather than sleep, the fix is just as simple. The next time you are at the pharmacy, ask your pharmacist this exact question. Is there a second-generation alternative to this allergy medicine that won't cross the blood-brain barrier? They will point you toward modern alternatives that treat your sneezing without turning off your memory. Now let's move to category 3. We are leaving the brain and going straight to your chest. I call this the heart rate spiker, and it involves systemic oral decongestants. Imagine it is the middle of winter. You have a terrible head cold, your sinuses are packed, and you just want to breathe through your nose again. So, you go to the pharmacy and you grab the strongest cold medicine you can find, often the little red pills containing pseudoephedrine that you have to ask the pharmacist for behind the counter. When you have a stuffy nose, the blood vessels in your nasal passages are swollen and inflamed. Pseudoephedrine works by forcefully constricting those blood vessels, shrinking them down so air can pass through. But here is the hidden mechanism you need to understand. When you take a decongestant as an oral pill, it does not just magically travel to your nose. It gets absorbed into your stomach, processes through your liver, and floods your entire circulatory system. It forces blood vessels all over your body to clamp down, and it aggressively stimulates your heart muscle to beat faster and harder. If you are an older adult, especially one with a history of high blood pressure, a previous heart attack, or an irregular heartbeat like atrial fibrillation, this is a recipe for a cardiovascular disaster. You are taking an older pump and forcing it to race like it is running a marathon, while simultaneously shrinking the pipes it has to pump through. I have seen patients come into the urgent care with heart palpitations, tremors, and skyrocketing blood pressure, thinking they were having a heart attack, entirely because they took a maximum-strength systemic decongestant for a winter cold. They treated a minor inconvenience and accidentally created a major cardiac stress test. The solution here is all about localizing the treatment. If your nose is blocked, we want to treat the nose, not the whole body. I tell my patients to swap the systemic pills for simple saline nasal rinses, which physically wash out the congestion without drugs. Or, if needed, you can speak with your doctor about a localized nasal steroid spray. These sprays stay exactly where you spray them, in the nasal passages, reducing the inflammation locally without ever jacking up your heart rate or tightening the blood vessels in your legs and arms. You get the relief you need without the Polypharmacy Cascade. But as dangerous as a racing heart can be, it's the fourth pill that is responsible for the most devastating, life-altering injuries I see in the emergency room. And the worst part? It all happens before you even have the chance to get out of bed. But as dangerous as a racing heart can be, it is the fourth category of pills that is responsible for the most devastating, life-altering injuries I see in the emergency room. And the worst part? The danger strikes before you even have the chance to fully get out of bed. I call this the fracture loop, and it is driven by benzodiazepines and older prescription sedatives. We are talking about medications often prescribed for anxiety, muscle spasms, or severe insomnia. When you are 40 years old, your liver and kidneys are incredibly efficient at filtering these medications out of your bloodstream. You take a pill at 10 p.m., you sleep, and by 7 a.m., the drug is mostly cleared from your system. You wake up clear-headed and physically stable, but as we age past 60, our metabolic clearance slows down significantly. The medical term for this is a prolonged half-life. So, erkolkontursum ontur erkraintriser. A sedative that used to clear your body in 8 hours might now take 24 or even 36 hours to fully process. If you are taking that pill every single night, the medication is physically accumulating in your tissues. Here is what that looks like in the real world. You wake up at 5:30 in the morning because you need to use the bathroom. Your eyes are open and you think you are fully awake. But because of that delayed clearance hangover effect, your central nervous system is still heavily sedated. Your motor reflexes are sluggish. Your blood pressure is slow to adapt when you go from lying down to standing up. You take 3 steps toward the bathroom door, you lose your balance, and you fall. That dizziness leads to a fall. That fall leads to a broken hip. That broken hip leads to a hospital admission, which requires surgery, which strains the heart, which leads to a massive loss of independence. I have seen this sequence destroy the lives of active, vibrant seniors more times than I can count. The AGS Beers Criteria strongly recommends avoiding these medications in older adults specifically because this fracture risk is so high. If you are currently taking a prescription sedative or anxiety medication, do not stop taking it tomorrow. Stopping these medications cold turkey can cause dangerous withdrawal effects, including seizures. You must taper off them under medical supervision. And that brings us to the most important part of this video. How do you actually fix this without getting into a fight with your doctor? How do you take control of your health starting today? I want you to use what I call the Shoebox Audit. Step 1. Find a shoebox or a large bag. Go through your bathroom, your nightstand, and your kitchen. Put every single pill you take inside that box. I mean everything. The prescriptions, the daily aspirin, the over-the-counter sleep aids, the allergy pills, the joint supplements, all of it. Step 2. Call your doctor's office. Do not wait for your annual physical. Tell the receptionist, I need to schedule a dedicated medication review appointment. Step 3. When you sit down with your doctor, open that box, put it on the desk, and use this exact script. I want you to write this down. Doctor, my primary goal this year is to reduce my risk of falling and to protect my memory. Knowing my age and my health history, are any of these pills on the Beers Criteria list? And if so, can we safely taper me off them or swap them for a safer, modern alternative? When you frame it that way, focusing on your shared goals of preventing falls and protecting cognition, you change the entire dynamic of the room. You are no longer just a patient blindly refilling prescriptions. You are a collaborative partner in your own health care. A good doctor will absolutely love that you asked this question. You do not have to accept brain fog, morning dizziness, or skyrocketing blood pressure as a normal part of getting older. Your body is incredibly resilient when you stop accidentally poisoning it with outdated medications. I want to know what your next step is. Comment starting today if you are going to gather your pills and use the Shoebox Audit. Binsio searcher and 10 soundan. Comment asking my doctor if you are bringing that exact script to your next appointment. Dear share sounds untouched. Comment sending this if you already know exactly who needs to watch this video right now. Please do not keep this information a secret. Copy the link to this video and text it or email it to a stubborn parent, a relative, or a loved one over 60. It is truly the greatest act of care you can do for them today. Save this video so you have the exact questions to ask at your next appointment, and make sure you subscribe to the channel so you never miss the medical truths you actually need to hear. I'm Dr. Robert Harrison. Take control of your medicine cabinet, and I will see you in the next video.